Hello, everyone. Dr. Maria Sampoulos. Thank you, Andrea Thau, for coming on with us today, for giving us this interview on the importance of doctors joining the AOA.
Thank you for having me.
So for those of you that do not know her, she is a fellow of the American Academy of Optometry, a fellow of College of Optometrists for the Vision Development, a distinguished practitioner at the National Academy of Practices, and diplomat of American Board of Optometry, a graduate from SUNY and a professor as well, elected president of American Optometric Association, New York State Optometric Association, and Optometric Society, City of New York. New York Academy of Optometry, serves as AOA Leadership Development Committee. That's how I've met her, and got really involved with the AOA because her passion really drew me to want to be more involved with the AOA as well. She's also a member of the AOA Political Action Committee, and policy chair, governing council for Vision Care Section, American Public Health Association. And she really oversees a lot of that with writing passage for APACA policies, and over the last 3 years as well. And she's founding member for AOA Infancy Committee and the launch of the Infancy program as well, and founding member of the New York Children's Vision Coalition as well, and is a great advocate for the state and local level, and is nationally recognized in the industry. And recently just got awarded America's Best Optometrist in 2022 by Newsweek magazine. And, again, other awards: New York State Optometrist of the Year, SUNY Optometry Alumni of the Year, SUNY Optometry Ben Franklin Society Award. The list goes on. And, as the Women in Optometry Thayer Award, she's been awarded that. And then Women, Most Influential Woman 3 times in the industry. A lot of great accomplishments, and has a practice in Manhattan. So welcome. It's such an honor to have you on us with the podcast today.
Thank you for having me, Maria.
For all the doctors that are listening to this podcast, why should all doctors become members of the AOA?
The American Optometric Association is the most important organization for every doctor of optometry to join. It's our family. It's our home base. It helps us take care of our patients. It helps us ensure we have access to our patients. It helps us ensure that we have scope of practice to be able to take a good care of our patients. It helps doctors like you safeguard your patient's eyesight. It's central to AOA's core mission of serving as optometry's only advocate at the federal and state level. It protects the care that you deliver and advances your ability to deliver that care. AOA is also your public voice to educate legislators, healthcare professionals, the media, and the public on issues affecting America's eye health and vision care, and how doctors of optometry are critical members of the primary healthcare team. So when you join AOA and your state association, you add your voice and, importantly, your power to the ongoing work of optometry, which protects your chosen and beloved profession. We did a recent study, and it showed that almost 80% of Americans who visited an eye doctor in the last 2 years thought that being a member of the American Optometric Association gave them more confidence in those doctors. It just gives you an idea of how much the public has an inherent trust in both the American Optometric Association and our members' doctors. So ultimately, the AOA and its affiliates help you build and maintain a thriving practice with essential clinical resources, continuing education, practice management help, and career development tools.
Yeah, I joined, and I've been a member for about 15 years now. I think these are all great points and things that I talk to doctors about as well. For employed doctors, what are some benefits of joining the AOA?
So the AOA and affiliate membership offers doctors and their staff the support they need to build and maintain a thriving optometric practice, whether it's through essential clinical resources, contemporary continuing education and professional development, practice management, career development tools, or leveraging the national momentum of patient and public campaigns. AOA member benefits help set up your practice for success. One clear number that demonstrates that what this does for our members is that AOA members on average earn 7% more than non-members. And some of the benefits that doctors might not realize that come with their membership, because there are so many things that you get. For example, AOA members can access a digital library of clinical care publications and resources that help guide you in clinical practice, as well as extensive resources to help doctors and practices answer coding questions. So, for example, AOA's evidence-based clinical practice guidelines range in topics from diabetes to adult and pediatric care. And these guidelines combine the best available current and scientific literature and research with expert clinical opinion to recommend appropriate steps in the diagnosis, management, and treatment of your patients. Compiled by the AOA's Evidence-Based Optometry Committee, these guidelines undergo a systematic and rigorous review process to provide clinicians actionable information. We also have a billing and coding resource for advisory and educational information related to accurate procedure and diagnosis codes, understanding and preparing for payer audits, changes in Medicare and coding policies, and ICD-10 information. Our member doctors can contact the AOA's coding experts for questions regarding medical records and coding for additional information in specific instances. But our AOA members can also leverage the personal and professional services of AOA's Excel's endorsed business partners to help your practice flourish. So some of the things that are included within AOA Excel are personal and business insurance in solutions. So that includes, for example, malpractice coverage. AOA's malpractice program is the best in the country. It covers you regardless of which state you're in. It covers you regardless of the scope of practice. You have to be careful. Not all malpractice policies do that. AOA Excel also offers HIPAA compliance, student loan refinancing, retirement savings planning, AOA Excel Career Center, practice financing and transition assistance, and vendor discounts and credit card processing. And one of our newest benefits AOA offers is the AOA Business Card, which is exclusively for AOA members, which gives business owners the ability to maximize the return on their purchases with 2% back in rewards on all purchases and no maximum cap on rewards. Additionally, AOA members will receive a 1-year reimbursement on the national AOA's dues while spending $15,000 on their card in the first 4 months following account opening. So there's no annual fee for this card. And if you use it, you get 2% back on rewards. It'll even pay for your AOA membership. So there's no, this is a great benefit that's came in, and this is just available to any AOA member.
Yeah, I went to that meeting, optometry meeting in Chicago recently, and they promoted that credit card, and I thought it was a great benefit. But I recently just switched over malpractice too, and it was much more affordable, easier. There wasn't all these hoops to jump through. And being a member of the AOA, I found that it's just easier to have all these things. And I didn't realize all these great things besides just business, but the clinical protocols and things like that as I start to expand my practice with myopia management and other things too. And a lot of doctors were looking for the AOA in the past with Vuity and things like that. And this is the organization that we look for to have all the experts kind of give us that information for our practices. So I think those are great benefits that a lot of us overlook. For me, it was, when I went to optometry's meeting, it was great to get CE. A lot of doctors kind of overlooked that as well. What did we get for access to CE as AOA members?
So AOA members have exclusive access to the AOA iLearn Professional Development Hub, which is an online CE and professional development library with recorded lectures, webinars, and other resources. Many are available for AOA CE hours, or the Commission on Optometric Certification Credit, which are all oriented to advancing clinical proficiencies and practice management expertise. It's newly redesigned with greater accessibility. The AOA iLearn is where our members can watch and join the impactful expert-led Ask AOA webinar series with actionable information on topics that immediately affect your practice. And I do want to take a moment to just mention that there is an added benefit of being able to add your staff as members, providing them with the breadth of career and practice supporting resources that AOA has created specifically to help support and advance your practice and patient care. So AOA member doctors can enroll their practice staff as AOA associate members at no additional cost to either the para-optometric nor to the enrolling doctor, and also gain access to educational and staff training resources to help develop their skills through the AOA iLearn platform, AOA associate members can participate in regularly scheduled para-optometric speaker series of webinars and access the ever-expanding library of staff training videos. So these resources help orient our para-optometrics towards professional certification that can help you advance the care you deliver and grow your practice. And all of us know it's really critically important to help our staff be the best they can be, because they help us deliver the care that we need.
No, I think that's super important, especially now with limited resources out there and everyone being short-staffed. Just having a place that we can send our staff to kind of get educated, making our job a little easier too, is super important. You know, AOA for me, for advocacy, is super important because I know our profession is a legislative profession, and I know our AOA has done a lot. What has AOA done recently on, advocacy front, and how do they help our members of optometry?
So the AOA and your state affiliate associations are the only ones who actively advocate on a 24/7, 365-day basis to protect and advance optometry. Any success we have is in large part due to these advocacy efforts. Ultimately, everything the AOA does for our members is to act as a voice to advocate for our optometric community. We are advocates for your ability to practice full scope primary care medical optometry and to provide valuable patient care that's integrated into the larger medical community. And we're also strong advocates for our professional development. So we're able, for example, recently when the pandemic started, to have HHS declare us as essential healthcare providers. That allowed us to be able to receive vaccinations early in the process. That was a huge thing. We also received the right in certain states to give vaccinations. AOA's advocacy efforts also helped repeal the ban on doctors of optometry doing laser procedures. And we were also able to get Anthem to discontinue the practice of automatically downcoding optometric services. But AOA's advocacy efforts helped our doctors of optometry get $2.3 billion in aid through the COVID pandemic. Initially, AOA doctors were not, and doctors of optometry were not labeled as essential healthcare providers. It was AOA's advocacy effort that helped define that. And as a result, our doctors were able to get access to the PPP loans and the provider relief funds, which either helped you directly, if you were one of the recipients, or helped your employer keep you employed during that time. And that was an enormous win. I can't think of a better return on my investment for that.
Yeah, that is a great return on investment. One of the big things in our industry that a lot of doctors talk about, there's a lot of discussion, is vision plan abuses, and it's really something that impacts our profession, our patients. What is AOA doing to combat some of those vision plans?
So AOA has always advocated for doctors of optometry to be able to provide a full scope care, be integrated into the healthcare system. When the Affordable Care Act came into fruition over a decade ago, AOA advocated, and that one of the 10 essential benefits was that patients birth through 18 could receive a comprehensive eye examination with materials. And so that was something that we've always advocated for. So our primary healthcare role is more recognized now more than ever, thanks to all of these efforts. And we continue that movement to ensure that as we're advancing our positions, that we're also advocating on behalf of payer issues. So according to a recent study, federally regulated vision and dental plans that mandate fees for non-covered services and material, and that require that the materials be provided by their specific laboratories, do harm by leaving patients and doctors of optometry, dentists, and other providers to pay the price in terms of higher cost, less convenience, and worse health outcomes. So the AOA and the American Dental Association continue to work together to help stop stubborn vision and dental plan abuses. Right now, AOA and its partners are singularly focused on building support for the AOA and the American Dental Association supported legislation, the Dental and Optometric Care Access Act, or we call the DOC Access Act for short. It fights against vision plan abuses. We've been working to build a broader coalition of supporters for this important effort, and we're proud to have more than half dozen new national groups fighting alongside us from both the left and the right side of the ideological spectrum, calling on Congress to pass the DOC Access Act now. This legislation aims to put patients and doctors back in control of important healthcare decisions by banning forced discounts on non-covered services and materials, and by banning from restricting which labs doctors can use. The legislation is now supported by more than 75 U.S. House and Senate leaders, but more backers are needed for Congress to act. AOA doctors and students can take action right now by texting DOC, D-O-C, to 855-465-5124. That's texting DOC, D-O-C, to 855-465-5124. And also by using the AOA's online action center to send letters urging their senators and House members to join as co-sponsors of the DOC Access Act.
Yeah, I mean, that's great. I mean, to have that information and have a place where they can just text. And the thing that really stood out for me was, us partnering with dental as well. We're power in numbers, right? And
Absolutely.
And I think that's super important. The AOA is also advocating to the public to what we do and perception. What are some things that they do to kind of promote our profession to the public?
So the AOA does a tremendous amount to educate the public about the important and essential work that we do. We've done this historically throughout the years, and we have become the go-to source by all of the media outlets. During the pandemic, there were two directions that we could have taken. We could have gone silent or doubled down on our public awareness efforts. In the past, the industry and the profession at large relied on Think About Your Eyes to let patients know about the importance of yearly eye exams. But unfortunately, that campaign went silent at the outset of the pandemic. And although we tried to revive that program, it was done not just with AOA, but across the industry, along with manufacturers and other groups. It did fall silent. And since it's not our nature to go silent, and AOA does not want to be silent, AOA doubled down with a significant investment to bring I Deserve More to life. This campaign is focused squarely on telling patients who we are and how we are integral part of their primary care. We're seeking to engage patients where they are, on and offline, and we are diverting them from misinformation that companies such as 1-800-CONTACTS are pushing. I Deserve More delivers what is critical to patients to ensure that they understand what doctors of optometry can do to help and make their lives better. One of the meaningful examples that we have to illustrate the value of this program is an email that volunteer doctors can send in and share with us. And as part of the I Deserve More campaign, we regularly promote doctor-patient stories on our site and through our paid media, cycling them at different moments in time. So for example, there was a great story posted by AOA member Dr. Amber Dunn. That story was visited more than 80,000 times, and multiple patients called her office because they found her story and were seeking her care. We can't expect that patients will let us know why they come in or how often they learn of us, but it's often a true testament to the value of the program. But this year, we're going even bigger. Our key audience that we have the opportunity to tap into is the gaming audience. There are over 227 million gamers in the US, ranging in age from children to older adults. And this group includes people from all walks of life and represents a rich opportunity to engage individuals, families, and health gatekeepers alike. So we just kicked off a first of its kind launch and initiative that we will reinforce that we are a lot of things that gamers do online. By caring for their eye health is critically important. We are partnering with gaming and screening companies, celebrities, influencers, and Dr. Gamers to tell this important audience that every gamer deserves to do more of what they love online. And to do so, they need to go offline with an AOA Doctor of Optometry for their in-person comprehensive eye exam. You can find more about this program and the campaign at AOA.org. I know it's been flashing up on my screen, both online when I've gone on LinkedIn. It's a great campaign. And I personally shared one of my stories that was in the I Deserve More campaign. It's really easy to do. So if you have a great story about something you did that was that changed that patient's life, we want to be able to share that story with the public.
Yeah, I mean, there's a lot of things optometrists do and that change people's lives. And it's great to have the AOA kind of be able to promote that to the public at a broad national level as well. There's a lot of things that being a member of AOA gives us benefits, but what are some non-measurable benefits that people just don't realize by being a member?
AOA membership means that you're adding to the collective strength of our profession's sole advocate. The AOA and its affiliates work tirelessly to challenge barriers that may hinder optometry's delivery of primary eye health and vision care in our communities. As an AOA member, you contribute to these advocacy efforts that help advance and protect our profession. AOA membership also opens doors to the lasting connections within the profession and among your patients. AOA members receive special registration rates for our profession's premier event, Optometry's Meeting, where attendees will find contemporary optometric CE and professional development, influential networking experiences, and industry connections that can help your practice get ahead. AOA is an incredible community. It's a family, and it's a team of people that come from all diverse walks of life, all different specialties, all different modes of practice, but we are one family, and together we are better.
Yeah, I found it super valuable to join and be involved, and I've gotten involved in the state level here in Rhode Island, and wanted to be more involved nationally as well, and got involved with the Leadership Institute. But for the listeners of this podcast, what are some valuable ways to get involved with their state or with the AOA if they're not already involved?
So the AOA could not provide the advocacy, education, practice tools, and public awareness programs that support our profession without the contribution of our volunteers. So recruiting passionate and energetic leaders with diverse backgrounds and experience to join the AOA volunteer network is essential to our mission and vision for the profession today and in the future. So how do you get involved with the AOA? First steps would be to connect with your state affiliate, your state association, and with the AOA. You can volunteer with both your state and national organizations. We want you. We want your help. We want your time. We want your talent. And I have been involved as a volunteer throughout my career. I'm a second-generation doctor of optometry. I watched my father as a volunteer in our state association and nationally, and his colleagues transformed the profession within my lifetime, that delivered the profession to the state that it was when I graduated. And then I felt the duty and obligation to pay it forward by being a volunteer. I showed up to my first meeting when I graduated. I raised my hand and offered to volunteer. And the next thing I know, one door was opening after another. And I'm helping, along with my colleagues, to transform the profession now to benefit the future generations. And I'm hoping all of you will join me as members of the AOA and as volunteer leaders. And one of the things is, as Dr. Sampalis has mentioned, is AOA created the AOA Leadership Institute, which is designed for ODs 5 to 10 years out of school to help give them the tools that they need to become leaders. And we're currently involved with the second year of the AOA Leadership Institute. And I'm so excited to see already what the wonderful leaders like Dr. Sampalis and the people who graduated last year or in this year's class are already doing.
Yeah, it's great to be involved, and you kind of have that mentorship program. You have that, you have people that have done it and can help you and get more involved and open doors. But yeah, you're right. I mean, your generation of optometrists are opening doors for mine, and I have had a great career so far. I'm 15 years in. I got another probably 25 years. But I mean, yeah, you want to pay it forward because you want to have the profession succeed. You see all these obstacles and in our profession, and the AOA really advocates and makes a difference to pay it forward. I mean, I think it's our duty to do so. And, one organization's the AOA that helps you do it. So why not get involved and be involved? And I'm very passionate about it. And I feel that all doctors of optometry should be involved and should try to volunteer some of their time. It's not a big time commitment. You can get involved and make a difference, and for yourself, for your community, your patients, because there are a lot of things that are obstacles within our profession. One last question. What is the difference that, makes for doctors of optometry as an AOA member?
Being an AOA member makes all the difference in not just your professional career, but your personal edification. It's been a foundational part of my life as a doctor, and I can't imagine what my practice or career or life would have been like without it. I encourage each and every one of you to reach out to your state association and AOA to discuss joining and how you can get involved. You will join the AOA family, which will enrich your life and your career. You can join by going to aoa.org/join. You can go to the website of your state association. You can feel free to reach out to me. I'm happy to help you in any way that I can. But all of those expressions are true. The more you give, the more you get back. And all I can tell you is all of the volunteer doctors that I know are incredibly happy people who have very fulfilled lives, both personally and professionally. And we hope you'll join us as not only just a member of your state association in AOA, but also as an active and engaged member as well.
Thank you so much for coming onto the podcast today. For the listeners, I hope that you get a lot of great information from this. See what the AOA provides as benefits, camaraderie, education, practice management, leadership positions. There's a lot of things that you can get it from AOA membership as well. So I hope you took something from this podcast. I hope you join the AOA, become a member, and get more involved as our profession changes, and you have be part of helping it change as the years go on.
Thank you so much, Dr. Sampalis. I couldn't have said it better. Please join AOA. We are one family. If we're not for ourselves, no one else will be for us. We need to advocate for our patients, and by advocating for our profession, we're advocating for our patients. So thank you so much.
Thank you for coming on, taking the time.